is JT Ramos, and today I'll be demonstrating how to put on your personal protective equipment, or PPEs. There are two types of precautions that we have in the hospital. There's standard precautions and transmission-based precautions. For standard precautions, what you would want to do is just wash your hands and put on gloves before you see a patient. For transmission-based precautions, there are three kinds: contact, droplet, and airborne. For contact precautions, what you would want to do is first you would wash your hands for 15 to 20 seconds, and then you would put on gloves and a gown. Infections that can be spread if you don't through contact are HIV and Hep A and Hep C. Next, there are droplet precautions. For those precautions, what you want to do is, again, wash your hands for 15 to 20 seconds. Then you want to put on gloves, a surgical mask, as well as a gown. Infections that this protects from are, an example of an infection that this would protect you from would be influenza. The last precaution that we have is airborne. For that one, what you want to do is, again, wash your hands for 15 to 20 seconds, put on gloves, a N95 mask, gown, shoe covers, protective eyewear, as well as a cap. An example of an infection for airborne, it would be tuberculosis. So for today, I'm going to demonstrate how you would put on how you would put on your PPE if you were dealing with a airborne precaution. So what you would first do, you would go up to your patient's room and check their chart. You would see what precautions they were and see what kind of protective PPEs that you should be wearing when you enter the room. So looking at the chart, see that they're under airborne precaution. So you would wash your hands 15 to 20 seconds. Then you would start putting your PPEs on. First, you would put on your shoes, your shoe covers. Then you would put on your mask. The way you would here. So you want to start with the bottom one? Put the top one. So it looks like so we have a little crisscross right here. Cinch this part right here to make sure that that's tight. Then you would put on your cap as well as protective eyewear. Then you put on your gown. So you want to make sure that you don't let the gown touch the ground.
Let me put it in earthquake mode.
So you put it up here. And you also tie it in the center. Once you have your gun on, you can go and put your glove. When you put the gloves on, you want to make sure that you put the gloves on over the cuff. Put your gown. That way you don't get contaminated here. So you just want to make sure you cover that part. Right, so now you have all your PPE on. So then you would go in and see your patient, do all the procedures that need to be done, and then when you leave, you would start removing all of this. So once you would start with your shoe covers, take those off, then you would remove your gown. What you want to do is loosen back here, then crisscross your arms, and tie this part first, then crisscross your arms, then pull away from you, and roll at the same time. Try not to touch yourself and so you don't contaminate yourself. You pull these off, and then you would throw this away in the proper trash receptacle. After that, you would take off your eyewear, your cap, and then you would pinch the front of your mask and just pull that off. And you would also throw all these away, or at least the mask away. And then you would take your glove off. So the way you would take your glove off is that you would pinch this thinner and pull that, then you ball it up right here, then using 2 fingers go on the inside of the glove so you don't contaminate yourself. Pull it off like that and throw it away. Then, of course, after you take all your PPEs, you again wash your hands for 10 to 15 seconds, and then you can go see another patient. And that's how you put on and take off your PPEs.